Today, India is under oxygen crisis. Supplying oxygen to everyone is getting difficult. That's why doctors recommended us Yogic self-care technique. Right. Oxygen measure SpO2, saturation of peripheral oxygen O2. It measures the percentage of hemoglobin saturated with oxygen, and it is measured by oximetry or through blood test. Its normal level is 94. Oxygen normal level in the body is 94 or above. SpO2 level, let's assume SpO2 level drops below 94 and we don't have the access to oxygen cylinders. So what to do? So there is a technique, COVID-19 pruning, for self-care. And what is it? It is a medically accepted process of turning patient from back to stomach. Right. And why it is important? Because it increases the supply of the oxygen in the body. Right. It is medically approved technique to help improve oxygen deprivation. Right. So how do you prune? There are three things you need to care about. One pillow below the neck, one or two pillows below the chest through the upper thigh, and two pillows below the shins. And when do we prune? When the body, when our body oxygen level goes below the 94, right? And it really helps patients who beat COVID-19 with as low as 75% of SpO2, right? A woman, an 82-year-old UP woman, beat COVID-19 using pruning technique. And we should prune to about 2 hours daily, right? And there is a 4 steps, 4 positions. First on the belly, right? Second on the right side, turning on the right side, then sitting up, then turning on the left side, then again on the belly. And these 4 positions take about 2 hours, because each position need to be rested for 30 minutes. Don't spend more than 30 minutes in each position, right? So there are 4 positions, 4 steps: on the belly, on the right side, get up, and on the left side. Some precautions to take while pruning, like avoid pruning for hours after meal, right? During pregnancy, avoid. During heart major conditions, avoid. Adjust pillow to alter the pressure areas and keep track of any injuries if you have. Maintain pruning as much time as easily tolerable. Right? And who not to prune? Who is under pregnancy, deep venous thrombosis, major cardiac conditions like heart conditions, heart problems, patient with unstable spines, patient with femur or with pelvic fractures. And it really worked. A 82-year-old woman from Gorakhpur in Uttar Pradesh managed to bring up her oxygen level by lying in a prone position. Right. So stay safe, stay healthy.